Laurel, the idea is Narcan should become much more prevalent throughout the state, helping save lives. But how will this work in practice? There are still some key questions.
I distribute Narcan.
Ellen Worship is determined to get Narcan just about everywhere people go.
It's really easy to use.
Bars, restaurants, clubs, coffee shops, stores.
Your medicine is held right there in that pink part of the vial.
Take your pick.
Thumb on the bottom, plunge, and then wait 3 minutes. The goal was mass accessibility to Narcan in spaces you wouldn't necessarily see it.
Her organization, Project Red, and the Alano Club of Portland have distributed free Narcan to 160 businesses and 56 schools since August.
More often than not, what I tell people is it's so much better to have Narcan and never need to use it than to need Narcan and not have it.
Does that hit home with people?
I think so. It's convinced a lot of people who didn't necessarily want to take Narcan to grab a box of Narcan when we've done distribution.
There's little doubt about the need. Narcan is an opioid overdose reversal medication. In Multnomah County, fentanyl overdose deaths have increased from 26 in 2019 to 209 in 2022. In Salem, Oregon lawmakers overwhelmingly passed House Bill 2395, declaring the fentanyl crisis a statewide emergency. The bill covers a lot. For one, fentanyl test strips would no longer be considered drug paraphernalia.
Being able to make an informed choice about what drugs you're putting into your body will reduce the number of overdose deaths that we are seeing, and how could that not be a good thing?
The bill allows public spaces and businesses to stock Narcan and make sure there's no liability for anyone, like a school teacher, who administers the drug when they suspect an overdose. In short, there aren't negative side effects, so when in doubt, don't hesitate to try and help.
Is that a relief for you to be able to say, once this gets to that point of like when you're talking to people, hey, you're not liable for this?
Sure, and I think this removes a lot of the fear that people will feel like, do I jump in and help? Is this a moment where I step in?
But there are still questions about arguably the biggest part of the bill, getting more Narcan out to Oregonians. The Oregon Health Authority is allowed to purchase Narcan in bulk, providing the medication at a discount or no cost to organizations statewide. Currently, the OHA's Harm Reduction Clearinghouse project is using millions of dollars from an opioid settlement to buy and send Narcan to community organizations. The intent is to use this bill to get life-saving Narcan to all sorts of new places, like libraries, parks, transit, and schools. But the bill doesn't include explicit funding for this. Aside from an existing application process, it's not clear how the state will entice new organizations to buy Narcan without subsidizing the cost. Organizations like Project Red can buy a kit of Narcan spray for around $43. Worship says if Oregon wants to get Narcan in more places, lowering that cost will go a long way.
You know, I do believe that, especially with the government purchasing and helping with that purchasing and giving bulk amounts, that we can start to see a reduction in the pricing of that Narcan. And, you know, that would be amazing.
Worship says addressing substance use is challenging and complex, but it's encouraging to her to meet people who want to be ready to respond to any potential overdoses they see.
Now, I get more requests every day for individuals who want to carry Narcan. I think that's a really incredible sign of where we're at.
About 90% of both the Oregon and House and the Oregon Senate voted in favor of this Narcan package. The Oregon Health Authority tells me supporting an opioid antagonist purchasing program for private entities would require, quote, additional staff and contracting resources. But it also says reducing the price of Narcan is a goal of its comprehensive statewide approach. So there's more to watch closely here. Laurel.